no, I think the inflammation is there, and it's just an irritant. It's no
Okay.
different than having a cut on your hand and putting alcohol on it.
Mm-hmm.
It hurts.
I want to talk a little bit about UTIs after sex. So I have a few questions from our audience. One is, if someone is experiencing recurrent UTI, but it only happens after sex, do you still take a similar approach to treatment, assuming that it could be an embedded infection, or do you do something else?
Absolutely.
So
Those
in that
patients have
case,
chronic bacterial cystitis.
and so you think it's not a reinfection happening after sex, it's actually just an exacerbation of what is already there?
Well, the bacteria are there.
Mm-hmm.
They're living in that urinary biome. Okay. And during intercourse, that biome is upset with the manipulation of the bladder. You develop some mechanical disruption of the urothelial layer. It releases some bacteria, causes an acute infection. You treat the acute infection, and it comes right back.
Okay. Do you have a theory about why some people seem more prone to UTIs after sex than others, if it happens for the first time?
Well, I think you'd be surprised at the number of people that have this problem. There's definitely a genetic predisposition for it. I'm not sure, where that is or what that is, but I would say 90% of the patients that I see with this problem have green eyes. And so,
Really?
so to me, there is, and this is something that, is researchable and is, we could probably figure out where the gene is, because it has something to do. It's close to the green eye gene. It's close to the it's close to the eye color gene. So
that is the first time I've heard something like that. Yeah.
That's pretty fascinating. I mean, I know when I go in to see a patient, I know they're going to have green or blue eyes. Isn't that crazy?
You should do that research, even though I know you don't have time.
Well, yeah, I know. I mean, that's something that I've wanted to do is, just look, at the human genome and see where that eye color gene is, and it'd be pretty fascinating. But there's clearly something there.
Yeah, that would be really fascinating. Do you have tips for people to help prevent UTIs after sex?
No, I do not. I think that, the only way to eradicate that problem is to eradicate the infection. And so, if that's the primary symptom and they have no symptom of any kind, after between periods of intercourse, then, it's not unreasonable to pre-medicate to see if they can prevent the acute infection from developing. It's a pretty long push, I think, to have intercourse related infections and try to put somebody on antibiotics for, a year or whatever. If that's really their only symptom, that you can actually manage really well with pre-medication.
Yeah. In general, if someone has recovered from a chronic UTI and they're fairly fine, what are your tips for them trying to prevent a future problem?
Well, I think if they really if they're really committed to preventing, Hiprex should be part of that program.
Does that mean forever, or just when they're starting to feel?
Yes.
Okay.
Yes.
Do you think there's any concerns around the safety of long-term use of Hiprex like that?
I think there is. Yes. I don't know what it is. I'm a little, I haven't used Hiprex very much except in the post-treatment phase. Looking at Hiprex chemically, there are, it scares me a little bit. It's an organic compound, and we know that there are problems with organic compounds. So if somebody is truly committed, I will go there with them. But I'm not just a huge fan of Hiprex.
Okay, fair enough. You mentioned briefly the genetic component. Do you see that the problem with chronic UTI runs in families?
Absolutely.
Do you know if that is an environmental, bacterial kind of thing, or you think it's actually something in their genes that makes them
Oh,
more prone to
it's
this?
clearly, it's an inheritable trait.
Hmm.
No question. You'll be surprised at how many of those patients have green eyes too, and their mother, and their grandmother, and their sister. It's
All with green
amazing.
eyes. Well, I'm going to wait for
Green
your
blue eyes.
research on that one. And then we can publish something about it. So with the people that do suffer from chronic UTI, do you find that they have sensitivities to certain foods and beverages that cause inflammation in the urinary tract?
Of course, I think that the inflammation is there
Hmm.
from the infection and the chemical in the food, whether it's strawberries or tomatoes or orange juice. I think the chemicals are irritants.
Hmm.
The damage is already there, and they just simply make it worse.
Yeah. Do you think it makes it worse and then therefore worsens the infection, or it's just the inflammation that gets worse and that will settle down?
No, I think the inflammation is there, and it's just an irritant. It's no
Okay.
different than having a cut on your hand and putting alcohol on it.
Hmm.
It hurts.
Yeah. So it's not a setback necessarily if you eat something that doesn't
No,
agree with your bladder. It's just
not at all.
temporary discomfort.
That's correct.
Okay, that's good to know. Another thing that many people report is that their symptoms flare at certain times of their menstrual cycle. Do you see that a
Yeah,
lot in your patients? And can you explain
all day long, all day long, and no, I cannot. You have some people that are symptomatic for 3 weeks and asymptomatic for a week,
it? Hmm.
and vice versa. I don't seem to be able to correlate it at all. But yeah,
Yeah,
there's
we
something. There's obviously something hormonal going on there.
seems to
I don't know
be.
what it is.
We also hear from people that experience all different versions of that. So there's no particular pattern. It's just something to do with the menstrual cycle.
Yeah, I mean it's clearly a hormonal issue.
Yeah. Okay. Are there any other supplements that you suggest that might improve the antibiotic treatment? So we've talked about Hiprex briefly, but is there anything else that you often suggest to patients in conjunction with antibiotics?
I do not.
Okay. So I have one last question, and that is that people often say they ask why doctors don't have more knowledge on this topic, and they can't find anyone to help. So they have no avenue for care. And someone asked if you have any insight into why that is and how they can go about finding someone that can help.
Well, I think most doctors, they just won't sit down and ask the questions.
Hmm.
They want they they want to go into the room. They want to look at some X-rays and see a kidney stone and schedule for surgery.
Hmm.
They don't want to sit down there and take the history and sort this out. Uh, and these patients, honestly, they take a lot of time. They take a lot of emotional energy, and most doctors are just not willing to spend that. And they know that if they do that, they're committed.
Hmm.
They're committed to dealing with the emotional aspects of this problem, and they're not willing to make the commitment.
It's
They
interesting.
really don't. They really don't want to drill down in the problem.
Yeah, you mentioned the emotional aspects of this problem, and you mean by that patient emotional processing over the problem?
Yeah, I mean, it takes an emotional toll on me as well as the
Mm,
patient. I
I
mean,
bet.
I mean, you spend lots of time working with patients, and you know, some of them get better and some of them don't. And the patients that are not getting better, they're sitting on the internet all day long watching the patients that do get better,
Yeah.
and they're very frustrated. They want to feel better.
Hmm.
And go ahead. I'm sorry. Yeah, it's an emotional. It's an emotional. It's an emotional condition because there's
Yeah.
so much frustration. Um, There's so much pain, physical and emotional pain. Relationships are lost,
Yeah.
marriages fail. Very difficult.
Yeah, I agree with that. Do you sometimes recommend that patients seek mental health support when they're going through this?
Well, I'm going to be real honest. I think that would be great,
Hmm.
but our mental health help is poor.
Okay.
And when I see patients that are clinically depressed, I just treat them
Hmm.
because I know they're not going to get they're not going to get the attention that they need if they look for a mental health professional. That help is scarce. They have to get treated, and the service to treat them is not readily available.
Yeah, we have been hearing from some people they have been prescribed antidepressants for pain relief. Do you find there's a connection there, or that it helps somehow with their physical symptoms?
Well, I think that anyone that has chronic pain is going to have depression.
Hmm.
I mean, there's nothing. The only thing worse than chronic pain is given the diagnosis of cancer, and both of those things, you know, lead to depression and they require treatment. If I had somebody that was clinically depressed and I went and started calling psychiatrists to try to get them seen, it would be weeks.
Yeah.
The service is not there.
Yeah, that's disappointing because I think it's very much needed.
Oh yeah, no question. I mean, I've just taken it upon myself in all kind of diseases, whether it's cancer or whatever. I know that the service is not there, so I have to provide it.